I think it's important to really go deep on topics like this because I don't believe that there's anything really more important than your health. I just don't. I don't understand how that it could be. And if we say, well, the most important thing is our health because that's what gives us our energy and our mood and our zest for life and our vitality and, of course, our life, right? Well, then what's the most important factor for health? And the most important factor for health would be the food that you put in your body. There's just no doubt about that. It's like what goes into your body and on your body, right? So, if you're putting cosmetics on the body, well, the body is literally eating those as well through the skin, right? Through the epidermis of the skin as well, the dermal layer. So, again, why is this important? Well, if we know that diet either improves your health and longevity or decreases it, then when we do know that, then we need to understand, well, what diet helps the most? And that's the Mediterranean diet. So this particular diet had the greatest improvement in protection against diseases, is a direct quote, such as heart disease, metabolic syndrome, cancer, diabetes, IBD, which is inflammatory bowel disease, cognitive impairment of the brain, and arthritis. And that's because it helps to control overall inflammation. The Mediterranean diet is known as the anti-cancer diet or the anti-inflammatory diet. It's one of the most potent anti-inflammatory diets in the world. Part of it is because of the monounsaturated fats, which I will talk about in just a moment, but it's also been shown in blood work to decrease what's called tumor necrosis factor, TNF-alpha, and it's been shown to decrease, if I didn't say decrease, lower, right, TNF-alpha, as well as nuclear factor kappa B as well, so NF-kB. So all of these are really important markers. It lowers CRP in the body. And one more thing I just want to share with you, just again, I want to try to impress upon you how important this really is. Because if you're in your 20s, 30s, 40s, even maybe your early 50s right now, you might not be thinking like, oh, well, it's not that big a deal for me. Trust me, the body is building disease or health every single time you have a meal. It's that important. It really is. And that's why people that are following a super high fat diet, and again, not the right fats, or a super high protein diet, what's happening is that they might be transforming their body. They might be getting the look of the body that they want, but they are sacrificing long-term health. And you're really, and again, if you feel good in this moment, great, but you're really playing roulette with your life. I mean, I really feel that way. And again, I have nothing to gain from offering you this information. I just know that based on all of the research that we have, as well as looking back to Ayurvedic medicine, traditional Chinese medicine, it's all recommending these same types of factors. Again, the food variation may differ slightly based on the locale in the world, but for sure, the philosophy does not.